My name's Dr. Manrina Rhode, and I am the aesthetic dental expert for dentistry.co.uk. Today we're talking about the dark side of cosmetic dentistry. There's a couple of topics I want to cover, and the first one I want to talk about is composite bonding. I feel like we're in the middle of a composite bonding pandemic. There's all these young people going out and getting their teeth covered in composite and thinking it's going to last forever, but unfortunately it doesn't. So we know as dentists that composite tends to last for about 5 years, and in that time it's prone to staining and chipping. Composite's made up of small balls that wear away with time, and they wear away at a different rate depending on how you're eating and drinking. So you get differential wear of your composite, which can be more prone to stain than, for example, a natural tooth or a porcelain veneer. So what are these patients going to do? They've got their 10 teeth, 20 teeth covered in big chunks of composite, which are difficult to clean. Hopefully they're done perfectly, and so they can floss nicely between the teeth. If they're not, then they're more prone to gum disease. If they've got margins that are difficult to clean at the gum margin, if the patient's not able to clean interproximally. I know there's some dentists popping bonding on and leaving the teeth stuck together, so patients can't even floss. So those are all issues in themselves. But let's assume the patient has had a perfect job by a brilliant dentist and had these composite veneers placed, and they've got great margins and they're able to clean. Are they aware that this composite is going to need to be replaced in 5 years' time? And if they're starting their composite bonding journey in their 20s, then how many 5 years are they going to live through? Assuming, I don't know, people are living to like 100 now, with having to replace this work. I think a lot of them are having it done thinking that it's removable, that it's not a permanent procedure. But how is any dentist going to remove composite bonding without removing enamel? So I think inevitably when composite is removed, the tooth is prepped slightly. So at those 5-year intervals, assuming it's only every 5 years it needs to be replaced, how much tooth are they going to lose, and what's going to happen through their restorative spiral or through their tooth's lifespan to these teeth underneath, and is that all being discussed with these young people? And if it is being discussed with them, then and they're still going ahead with it, are they going ahead with their eyes wide open, or are they? And then later on, we're going to see the repercussion of their actions. I think that's what's going to happen. So I think we need to assume that work's being done well, and I think we need to assume that patients are being informed of the complications, and that patients are still going ahead with these treatments for cosmetic reasons, because it seems like a great idea to have this big white smile right now. But I think long term is where we're going to see what complications have arisen from that. So I think that's food for thought, and something we should all be thinking about, and as dentists be getting ready for as time progresses in the next 5, 10, 15 years, and these patients come back with their now worn, stained composite, deciding what we're going to do for them. At what point are we going to move them over to porcelain? And when we do move them over to porcelain, then how well trained are you to do minimally invasive preparations of porcelain? We're not taught how to do porcelain veneers at university. It's something that if you have an interest in, that you decide to learn when you graduate. You can learn from me on my Designing Smiles course, and obviously there are other courses out there that you can go on and learn. But the key to doing beautiful porcelain work is pre-alignment, so align your teeth so you're not having to prep them, and getting lovely margins. And also not just doing a one-size-fits-all, cut every tooth down to a peg so they're not veneers at all but they're crowns, so that you don't have to use any skill set with that, and sticking these crowns on people's teeth, because you're taking them so far down a restorative spiral by doing that. So let me talk to you a little bit about a restorative spiral and what that term is that I keep using. So when a patient comes into us and they have a virgin tooth, and then they have a small amount of decay in that tooth, in a fissure of that tooth, and so we decide to fill it, and we pop in a fissure sealant or a composite, and then or maybe use amalgam. I don't use amalgam, and then over time you can get decay underneath that filling composite, because it's composite and it's going to wear, and depending on your diet and your oral hygiene habits, you could get decay underneath that filling, and you end up needing a bigger filling. So you end up with a bigger filling, and then that filling could turn into an inlay, or your decay could get close to your nerve, and the tooth could eventually require a root canal treatment. And then the patient's got this tooth with an onlay on it and then a root canal, and then at some point that root canal may fail, and then they may have a re-root canal, and then they've had a re-root canal, and then potentially that fails, and some of the tooth breaks off, and then they've got a post and a new abscess, and then maybe they need an apicectomy. But at what point maybe at that point you're then like, okay, enough, and then they lose the tooth. And then what do? You've got leave the gap, denture, bridge, implant. But by then, they've come all the way down this restorative spiral, right to the bottom of it, and now we've got no tooth there, and we're looking for non-human made alternatives, man-made alternatives for this tooth. And I think really it's our responsibility as dentists to try and keep patients with their own God-made teeth, if it's okay to use that term, for as long as possible. We don't want to get to a point where they lose their teeth, and then there's not really very many other options. You can place an implant, but then that implant fails. Then what are you going to do? So you really want to postpone that for as long as possible through their age. Even I do a massive amount of porcelain veneers. I've done over 13,000 in my career, but whenever someone embarks on that journey with me, I sit very carefully and say, okay, my porcelain veneers will probably last you 15 years. So in 15 years, how old are you going to be? And then in 15 years, I assume with technological advancements, it used to be 10 years, now it's 15 years, it will probably be 20 years. So then if they're going to last you 20 years, then how old are you going to be? So we can work out before even starting the treatment how many times their work is going to have to be replaced in their lifespan, and I think that's an important conversation to have with any work that we do on our patients.